case of the spleen. They store blood in the case of the liver. And they are paired with an external fu, which is loosely located bowel. Those are usually transport mechanisms, and largely due to, in the case of the lung, like stomach and large intestine, it's food. Some of them, like the triple burn, is a little different. How do you go, or pericardium, right? Pericardium's protector, triple burner is kind of the food that. What does it transport? Well, it's kind of water and chi in general. It gets a little abstract. But when you go through each of those cycles, they are kind of paired. You'll notice also, so Zong and Fu, the inside, you'll notice it starts with the Zong, right? The internal lung starts. So this is what I want you to understand. The Yin, this is the first of, it rides the white and red skin on the palm. That's one of the distinguishing features. It's kind of this radial head to a certain extent. Again, the softer Yin versus the more aggressive Yang surface. Goes up the arm, again follows the radial side of that bicipital tendon, comes up around and ends up just under lung 1, starts just under the coracoid process. So the flow of energy is from the chest down through to the hand, comes off at the thumb. Its paired meridian and it is the large intestine, which is now the opposite side. If you make a fist, you will notice that lung and large intestine actually kind of have somewhat of a connection there. So that's the large intestine coming off the index, coming up. This is a big one, large intestine 4. Comes up the outside of the arm, almost follows the brachioradialis to the back of the arm, then comes up through the shoulder, crosses, comes up the SCM. Large intestine 18 is a big one right about mid at the level of the thyroid. It will come up, cross over, and actually in most shows it crossing over to the opposite side of the nose, just under the nares, or the nares. Then picks up, what's the next one? So lung, large intestine, what was the next in there?
Okay, what, spleen?
Stomach.
Oh,
So
stomach.
we went from the chest to the hand, from the hand to the head, from the head to the feet, in this case stomach, just under the eye, infraorbital foramen, comes down, it actually crosses over to meet with CV24 at the chin, and then it'll cross up, kind of makes a U shape. Some don't show that connection because it's not technically on it, but most will kind of show a U shape. This is called head's binding, stomach 8. Then it comes down to the SCM and then over to the collarbone. Mid, so 4 soon, this is the collarbone is 8 soon. Comes down through the nipple line. After the nipple, there's one more, Bruggen, which is 16. Then it crosses over, it goes 2 soon out and follows down. Then it goes through the leg, stomach 31. It's almost like rectus femoris. Comes down 35 is do B, calf nose. And then comes down the foot, follows 1 finger breadth lateral to the spine of that tibia. In the fat part, this is the stomach is associated with earth, fullness, muscle. So this is a good one for doing that. Stomach 36 actually, Susan Lee, 3 leg miles, 3 soon down. That's a big one for the leg, or for the stomach meridian for just endurance. We'll talk about that more. And then it follows down and goes out to the lateral aspect of the second toe. Spleen. So this is what, so I talked about that. So we talked about lung, inside of the arm. What was the pathway? What was the full name? So it's lung, channel of hand, and then there's 2 other words that describe the position in the body. This is the first one, Tai Yin. So Tai Yin is the first of it's the first level coming into the body. Tai Yang, so it goes Tai Yang, Xiaoyang, Yang Ming, then Tai Yin is the first one. This is kind of the first most superficial organs of the body, like the lungs are they get air and exposed to the elements a lot. This is Yang Ming. So it's lung, channel of hand, Tai Yin, then it's large intestine, hand, channel of hand, Yang Ming. Then we go to, so it goes up, then it's stomach, channel of foot. It's on this same aspect of the foot. So it's what? Channel of foot. It mimics the large intestine. Yang Ming. So foot,
It would be Yang Ming.
so stomach, channel of foot, Yang Ming. And then it pairs up with the spleen, which is analogous to the lung. So it would be spleen, channel of foot,
Yang or Tai Yin.
tie in, right? So that, and actually that's one of the things I'd like to do is, I know these cameras have some capacity to take a picture and you can like highlight it. I tried doing that with my phone, I just don't know the tricks of the trade. Maybe my phone doesn't do it, but that would be cool to just get one of those and practice that. So shadow, and then say what channel is this, and give you 4 choices. So you
Okay.
can kind of use that as a memory to chart. Because you should know, there's 6 on the hand, 6 on the back. They're named the same, it's just hand. So Yang, Ming, Shao, Yang, and Tai, Yang.
Wait, so it's bilateral, so anything on the right is on the left?
Yep.
Okay.
So they mirror, and it's the same on the foot, except instead of hand, it's foot.
Okay.
So they're not, there's just really 6 levels that you gotta memorize. But that whole yin yang, that internal, external, that balance, that flow back and forth. The one, we'll see how I'm gonna go. I've got 6 minutes here. I'll try to keep these about 10 minutes, and I don't want to keep going over the yin yang stuff all the time. But it's really, because sometimes it's reinforced, much like the next aspect is the 5 elements, right? So yin yang, we talked about relative amounts of force, what they call shu and ji. I brought a book, an older one. This is one of the more classic ones that kind of shows that disease. So you can have disease from a deficiency of something, yin or yang, in which case the other will dominate, or you can have an excess of one which will damage the other. This book, I was going to copy these off and kind of show these because it does talk about, and it gives the description of it. It's right here. Let me take that back. There we go. This is the one I'm showing you, so you can see this. So in a normal state, yin and yang should be balanced. So when you have excess or deficiency, in this case, a shi, which is a excess of something. So in this case, we have excess yin, which leads to a yang deficiency, and another shi would be an excess of yang, creating a yin deficiency. You can also have deficiency syndromes, which are shu or xu. That's where the lack or the diminishment of one of them causes the other to kind of relatively act dominantly. And so those are 2, this is a deficiency. Weissman calls these effulgences, or just excess. There's different, you're going to see some terms that are somewhat confusing, especially the translation from Chinese to American is sometimes off, and even for meridian, how they talk about the meridians, Jing and Luo. There's 2 kind of different concepts that are, some are more blood, like the Chong vessel, which is largely almost analogous to the aorta. They talk about energy coming up the Chong, and it's very obvious that that's kind of what they're talking about, or going down the Chong, I guess the aorta going down, and on the other side coming up. So they had some of the interesting concepts. So that's that whole thing with the yin and yang. They're interbalanced. This is really the ultimate, when you distill down what you do, that's what you're going to try to find with that patient. Is this generally dominant, like a yang type of condition, or is it due to deficiency? Some cases, what you're going to do is you're going to build up the yin, which are the cooling agents, the water, the nourishment. Sometimes you need to warm, yang. Awe detract was the so activation, warming. Those are all things that yang does. They kind of sometimes wake and they start cycles up. Defense, chi or yang chi. That's the energy that theoretically goes to your pores. That's why they open up. That's why a disease that's one of the ways you'll determine a yin versus a yang condition when you talk about a patient. So is it a yin or is it a yang condition? Well, a patient who is otherwise in pretty normal health goes out and develops a fever and they're aggressively sweating. That And otherwise, they're kind of agitated, they're feeling good, and we'll talk about some pulse determinations. Usually the pulse is gonna be superficial. That means that yang energy is going to the outside, opening the pores, trying to actively expel that pernicious agent, whether the damp, cold, heat, wind. On the other hand, a patient who has a fever, but they are not sweating, they tend to be more like lethargic. They've lost their energy, they're dried out. That tells me that the yin has been used up in the body. Their tongue will be cracked. You'll see there's some tongue diagnosis, pulse diagnosis, things that will show up. So that's going to be more of a yin. So what you'd want to do, actually, for those external, what they call EPI, external pathogenic influence, you guys have heard of ephedra, Mawang, Mahuang. It's an herb that has been prohibited, but it was a big piece of Chinese medicinal therapy for externing. It pushes stuff out. So it kind of gives you this false sense of energy, whereas others, so that would be you're trying to push it out actively. In other yin, you might want to do things that would nurture yin in the stomach. So just different treatment plans and protocols. So that's already 12 minutes.